Porphyrias. What are porphyrias? So to define, porphyrias are rare, inherited or acquired disorders which are caused due to the deficiency of the enzymes in heme synthesis. What happens in porphyrias? So due to the enzyme deficiency in heme synthesis, there is either accumulation of intermediates and also there is excretion of these intermediates or intermediary products, and these accumulated intermediary products will cause cutaneous manifestations and neurological manifestations. Coming to the types of porphyrias, porphyrias are divided into congenital porphyrias and acquired porphyrias. So these congenital or inherited causes are again of two types, erythropoietic porphyrias and hepatic porphyrias. Now if the enzyme deficiency occurs in the red blood cells, they come under erythropoietic porphyrias, whereas if the enzyme deficiency occurs in the liver, they come under hepatic porphyrias. There are different types. Under erythropoietic porphyrias, there are two different types. One is congenital erythropoietic porphyria and the other is protoporphyria, also called as erythropoietic porphyrias. And under hepatic porphyrias, there are 5 different types. First one is ALA dehydratase enzyme deficient porphyria, that is aminolevulinic acid dehydratase deficient porphyria. The second one is acute intermittent porphyria, which is the most common one. And the third is Porphyria cutanea tarda, which is the second most after acute intermittent porphyria. And the fourth is variegate porphyria. And the fifth one is hereditary coproporphyrias. Acquired porphyria, the most common cause is lead poisoning, mainly seen in children who suck the painted toys and they get affected. So this lead mainly inhibits the enzyme ferrochelatase, which is the last enzyme in heme synthesis, and as a result there will be decreased level of heme in these patients. So difference from congenital variety is there is a presence of anemia in acquired variety because of deficient heme synthesis. Coming to the clinical features of porphyrias, the clinical features, if the enzyme deficiency occurs early in the heme synthetic pathway because of accumulation of this delta aminolevulinic acid and porphobilinogen, there will be acute abdominal pain and neuropsychiatric symptoms. Whereas if the enzyme deficiency occurs later in the heme synthetic pathway because of the accumulation of intermediates which absorb light and form oxygen free radicals, that in turn cause skin damage and scarring, leading to photosensitivity and skin lesions. So basically there are two different types of symptoms. One is acute abdominal pain, neuropsychiatric symptoms, and photosensitivity and skin lesions. Diagnosis of porphyrias, UV fluorescence is the best technique to demonstrate the porphyrins in biological fluids. So if present in urine, the porphyrins if present in urine, they will emit strong red fluorescence when observed under ultraviolet light. And Ehrlich's reagent is also useful for demonstrating porphyrins, that is dimethylamino-benzaldehyde. This helps in detecting porphyrin precursors in urine. Now especially this reagent reacts with porphobilinogen to form a pink aldehyde compound. So this is about high yields of porphyrias. Thank you.